Good evening, everyone. Welcome to this regular December meeting of the Health and Human Services Board, December 28th. Tech noises. Welcome, everybody, for being here. Checking the roll, it looks like everyone is here except Supervisor Robinson and Dr. Hall. All right. We need approval of the minutes for November 23rd. They were in your packet. Supervisor Steen moves. Is there a second? Supervisor Breslin seconds. Any additions or corrections? Additions or corrections? If not, the minutes for November 9th, I should have pointed that out. November 9th are approved. We didn't have a meeting on the 23rd. We had a meeting on the 9th. All right, there we go. Do we have any public comment tonight? No public comment. All right. Without objection, I'm going to make a couple of adjustments to the agenda for staff people who are here to make reports. Lori Radcliffe is here. She is the supervisor of the Family and Children's Unit in the Department of Human Services. Jeff Robb is also here. He's the manager of environmental health in the health department. We'll just let Lori go first, if that's all right. Take as much time as you like. We're anxious for your report. Lori.
So today I was asked to come by Paula to talk about family treatment court. And kind of give an overview from the perspective from Human Services. I believe that Sarah Benedict has come at one point or another and has also gave a report.
Not to this committee. She has done for the full board. I don't remember the last time. We could do that.
Okay. Well, let me start a little bit. I'll start a little basic from, so family treatment court. So I manage, I'm one of the managers in family and children's and with Carrie Anderson, and we'll be bringing on Connie Feedy next week. And so I have been managing the initial assessment workers, ongoing CPS, and started managing family treatment court in 2019. In 2019, Chris Corpola came to Carrie Anderson and I, it's Carrie Nearing at this point, but, and said, we're going to do family treatment court. I'm like, okay.
Okay.
I'm not quite sure what that is, but okay. She's like, well, just so you know, it's going to be a lot of work. So with that said, I said, okay, let's give it a shot. So in 2019, Sarah Benedict and Chris Corpola had applied for a grant. They received that grant. And from there on, we developed a program that initially started in the CJCC with Sarah Benedict. And at that point, when it started, Derek Smith was hired. And it was a good start, 2019, and then COVID hit. So with that, so we, in 2019, we had, let's see here. So from our perspective in the CHIPS side of things, we had 50 CHIPS petitions and 30.
Could you define that, please?
Yes, child in need of protection and services. So we had 50 child CHIPS petitions, and 35 of those were substance related. And in 2019, we had 8 termination of parental rights, which is pretty high.
High.
Then you move to 2020, we had 62 CHIPS petitions and 37 were substance related, and we had 11 termination of parental rights. 20, and so I'm saying these numbers in correlation to how we started family treatment court in 2019. In 2021, we had 67 CHIPS petitions, 47 were substance related. So more were related to substance use. But we had 4 termination of parental rights. In 2022, we had 64 petitions and 16 were related to substances and 4 termination of parental rights. So, you know, the CHIPS petitions may have kind of stayed roughly about the same. The substances have not, that hasn't really decreased if you look at the big picture of all the cases that we deal with. But termination of parental rights has drastically declined. So I said in 2022, there was 4. In 2023, at this point, which we're almost at the end of the year, I believe we have 2.
Wow.
Yeah, I think that's a huge success in looking at what the program has done for our families. And so what Family Treatment Court does is, in order to enter Family Treatment Court, you have to be referred. And at that point, you have to have a significant, moderate, significant substance use related concern. And then at that point, once we file a petition, you are eligible, and we have a CHIPS order, you're eligible to be referred to Family Treatment Court. So the process is a little long because we have to get into the court process. We can do a referral, but you can't enter and start the program until that order is in place. And it's a voluntary program, and so parents have to be willing. Which I think when you start the program initially in 2019, nobody really knew what that meant. And so you really had to educate the Family Treatment Court staff, but also the Family and Children's Services unit to see the benefits, because on some level, that could also look like they're giving up a lot of control about what happens with their families, because it is, when they enter Family Treatment Court, they meet with the participants. They'll have a Family and Children's Services worker, and they'll have the Family Treatment Court coordinator. And so the coordinator coordinates the assistant coordinating their services, but really it's about monitoring what their substances look like, what they need in order to receive the services for their substance use. So they can help coordinate treatment. They help coordinate potentially CCS referrals, peer support referrals. It's just another oversight of the service delivery. And then they have they see a judge. The participants come in front of the judge every other week. So we staff them weekly, then they're in front of the judge every other week, which is a lot, because families can go for 6 months without seeing a judge or have any judicial oversight otherwise. So Family Treatment Court is more intensive. They meet with the coordinator every week until they get further down the process. And there's 5 phases that they go through. Let's see, I'm trying to think of what I'm missing in the overview of it.
So when the families and the staff meet with the judge, have they set measurable goals that the judge can review?
Yep.
With the workers and the family?
So basically the coordinator is kind of responsible for reporting out what has happened and what has not happened for that participant. And so one of the things that they do have, the participants have to randomly drug test usually 3 times a week. So they are called in. It is a lot. Yep. And so, and that can be seen as that's a lot, that's an expensive cost. But what happens is, if Family Treatment Court wasn't doing it, the child welfare worker was doing it, just to also, provide that oversight and seeing, is there a decrease in their use? Is there, where are we at? What's the baseline at this point? And that cost is associated with the grant that we received. So that also helps offset all that cost. The other things, they have to meet what we call wellness slips. So participants have to be involved in, the goal is to really help assist the participants who often don't have a community and don't have social supports. So the goal is really trying to build that in and teaching them that, oftentimes your whole life has to change when you're dealing with substance use. And so there's the wellness slips, which could be something as simple as going to a sporting event with their kid, because that's a community-based pro-social thing, or it could be going to their AA meeting, or it could be meeting with their peer support. And the peer support is really somebody that has lived experience, often with CHIPS cases or other substance use. Which is a huge, the peer support is one of the #1 factors to success for the participants to graduate. Because they learn how to rely on somebody that has a healthy support system. And then we also incorporated this year, moving forward with an improvement in family treatment court, is bringing on a peer support liaison. So somebody that is going to be part of our team to help us have oversight from what their lived experience is in helping the participants. Like, what are we missing as professionals, having not had that lived experience? And just another lens to support somebody who has substance use difficulties. Yeah. Are there any other questions? I have an example of some successes, a success that I think is really huge.
Are there questions for Lori before she moves on?
I'm just curious about transportation for some of these families. I'm assuming they don't have a valid license at that point in some cases.
Hit or miss.
Okay.
And so one of the examples for somebody that we have had that, the child welfare worker picks up the participant, gets them to court every other week. Or they also get an incentive for attending court. It's like a $5 gas card, so that also helps offset somebody's transportation to court. But we figure that out because we believe strongly if we can get somebody there and they feel supported, they'll be more likely to continue to come.
Supervisor Breslin.
You mentioned graduation. Is there any monitoring after graduation for backsliding or so forth, so on?
So some participants, depending on where they're at, so they'll graduate family treatment court and have a closed case, a CHIPS case. So sometimes those go together. It's not a black and white, like, oh, they graduate, they close. Sometimes we believe that some people need, and they request additional support after, because the program does offer such intensive support and services. It depends, it's a case by case. And then we do the surveys after to see whether or not someone stays successful. We've had many participants graduate, well, we had one participant that graduated that went on to be a peer support herself successfully. We have that same participant graduated and she was recognized by the state for her success in our program. We have a few other participants that have recently graduated that are going on to be peer supports. They haven't officially got to that. They haven't gotten the job, but they're going through the training to offer that to their peers. There are some scenarios where they graduate and it's not successful. There hasn't, I think there's, if I can recall off the top of my head, 3 participants that have come back into our system after graduation. One of those participants has been in the system for 20 years. So, dealing with addiction. Yeah.
Supervisor Steen.
Yeah, Lori, is there any way or to quantify, the money laid out up front to do this versus how much money you save on the back end by being successful? I don't know that, I mean, it probably is quite a difference. I mean, preventative versus palliative care, if you want to call it that, later on,
Mhm.
And I don't know if there's a way to quantify that, but I think if there would be, I would ask Paula or Chris or anybody, that type of figure would be pretty helpful if it could be delivered for the board's understanding of, yes, we're laying this out, but look what it does. Thank you.
Oh,
And I think that's probably pretty challenging to do because each person is different, but you can throw out different scenarios of the criminal system. If there's not change, you can throw out the scenario of children in foster care and the impact of trauma. And then, of course, them moving into adulthood and parenting and the children. We've seen that, the cycle of years and years of families. We, underneath, Badger Care, we're paying for people's symptoms of abuse through the medical needs for years and years and years, right? So it's hard to capture all of that because each case would be so different, but, certainly you can imagine the dollars.
has there been a formal evaluation of family treatment court? Why would I ask that?
No,
Yeah.
no, not like we did with adult treatment court.
Okay.
So, when we started in 2019, there's been a lot of growing pains. Like I said, it started in the CJCC. I, am extremely passionate about family treatment court. As we know, Chris Corpola was my manager or my boss prior to her moving on. And we had many, many conversations about, I strongly, strongly believe that family treatment court needed to be in the family and children's unit because of the work that we do. And we coordinate with Sarah Benedict, and she's still a very large part of it. But the families that we serve are so well known to our unit, and the child welfare workers are the experts in those families. And then we assist them in providing this program and the delivery of that. And so it's a team. And when it was separated, it just had a lot of obstacles that didn't fare well for, communication wasn't as open. And it wasn't a fault to anybody. It was just the separation
Yeah.
and different roles.
Supervisor Steen.
If I'm understanding this correctly, what I'm hearing is that the thrust is to treat the situation as a whole rather than the individual. And so, I mean, the whole family, because that's, they would all be dysfunctional, probably. So if you treat the whole, it
Mhm.
supports the rest of it. Yeah, okay. Yeah,
And
thank-
so when we moved it to the family and children's unit, we were able to, that worker then knew those kids, they know those parents, they know the placement providers. We know how then to get somebody that doesn't have a license to the home. We're used to going out to anywhere we need to pick up a parent and not have fear or worries that that's just what we do. That's part of, some of the trainings I've attended is one of the things that they kept looking for me. They kept reaching out, and that makes the difference because they have no hope. And so I think family treatment court is offering families hope in a different light. We just recently had a Christmas party for them, and past the graduates that graduated in 2023 were also invited, and they still came. They came with their families intact and their kids that were reunified. And to see the difference from when they first came into the system, in court, and it's shameful, embarrassed, defeated, and they were, successful, working full-time. They have their kids. Many of them have had more kids, but successfully, and no new CPS reports.
Interesting.
So we've had many, many successes, but one more case that I would just want to say, we have one mom that came into our system in 2022, and she had 4 kids. And they ranged from probably, I think 8, 9 was the oldest, all the way down to a newborn. And she had, at the time she came into our system, she had reports dating back to 2016. The kids were never removed. Prior to 2022, 4 kids were removed. She entered family treatment court. The kids were in care for 15 months before she got her kids back, but she got her kids back. And during the time that she was in family treatment court, she just graduated in December, but during that time, she did relapse. She But she relapsed knowing that's part of the process, and she relapsed being supported and able, we then as a unit in family treatment court can plan around what happens when you relapse. Does it mean we just yank the kids? It doesn't necessarily. What do we need to put in that home to keep those kids safe and that you're feeling supported, knowing that's part of your process? She reunified with her kids after 15 months. Without family treatment court, without a doubt in my mind, that would have been a termination of 4 kids. And she herself grew up in the system. She works successfully now. She's had a new baby who was born without any substances in her pregnancy. She continues to be in CCS, still being supported in other ways. And we still have a case open, but she graduated. So it's one that we feel like she needs additional support just to keep for her to feel supported and services. She's a single mom, doing really well, but I think she's a huge success for somebody that without a doubt, without family treatment court would have been a termination of parental
Sure.
rights.
Thank you
So-
for sharing that story. Other questions or comments for Lori?
I could go on and on, so
Well-
just tell me to.
If you've got another success story, feel free to share it.
I do. I mean, so we have another dad. So we had a case where it was a mom of 4 kids. She received some very intense criminal charges, was incarcerated. The dad was a biologically dad to one of the kids, but 3 of the other kids were hers and not biologically his, but had raised them. Huge domestically violent home. He entered family treatment court. Was driven from Eau Claire every day because he then had moved to Eau Claire because of housing. Our workers transport him every other week to family treatment court. You just would never guess that this man became a licensed foster parent through a rehab. He had a rehab review, allowed him then to take on the 3 additional kids, successfully graduated. I don't think he ever, no, I'm not even sure he ever relapsed in his process. You can't even recognize him today, just from the support that he received from the child welfare workers who, I can't say enough about them in our unit, that they're just so willing to do anything to make families successful.
Yeah.
So he just obtained guardianship last week of those kids, and our case will close.
Interesting.
Mhm. Yeah.
Well, thank you for that, and thank you for the way, the way the workers in your unit are so passionate about taking care of our kids. That's important,
Yes.
very important.
Thank you.
Anything else? If not, thank you, Lori, and please take a piece of birthday cake on your way out.
Sounds good. Happy birthday. Okay, you're welcome.
Thanks very
Happy
much.
New Year.
Thanks for joining us.
Yes, you're welcome. Thank you for letting me go first.
Yeah.
What we call this birthday court.
Birthday court.
Take a slice off.
Yeah, you're good. KT, if we move to Jeff, do you want to provide a tiny little bit of context?
Sure, absolutely. So in your packet, you guys have a couple things from environmental health. And Jeff will absolutely expand on this. One of the things that we committed to last year in January is that we would take a good look at our fees regularly and match them to our time tracking so that we are putting direct costs towards those fees and not other things, and not necessarily not recouping our cost. You guys will remember a couple months ago, we had so the fee structure goes on the State Department of Agriculture, Trade and Consumer Protection, DAC caps cycle. So that is a end of June to beginning of July. And so in July, some of our operations felt some pain, and they were appropriately vocal about the pain that they were experiencing. And so you had some comments on that. And so we wanted to take the opportunity again, to use the board's guidance to be between 70 and 100% of direct cost recouped, as well as kind of massage those fees that weren't in line with the state and were in line with our neighbors. And so a couple different areas, you'll see that. So we're bringing this to you today for a conversation, and then we'll bring it back for, with your guidance for decision-making next month. Again, as a reminder, we need to put out the renewals in May, and we need to have all of our ducks in a row in April. And so that's kind of our timeline as to why we're bringing this to you so early in the year. And then I will share my screen as it's helpful, and Jeff, please add what needs to be shared.
All right, Jeff Robb again is the environmental health manager, and he'll talk about this process, which the board will remember we did discuss and approve moving forward with the time tracking. So Jeff, please.
Thanks. Appreciate that that introduction, KT. Just as a reminder, so me and Amy, the other inspector, environmental health specialist, we both started in November of 2021. We do also have a part-time secretary in environmental health that started in April of 2022. So when we first got here, it was kind of just trying to play catch up with stuff, and now we're trying to get our fees, like KT said, to match where we're spending our time. So I thought it was interesting. KT found a annual report from 1998 saying that we were agent of the program for DAC-CAP. So that doesn't seem like 1998 was 25 years ago, but it was. So we've taken on this program for over 25 years now, and obviously, like we mentioned last time, the primary goal is to have more of that local control and touch on public health and the safety of the community. So I think KT touched on a lot of this program background, the objectives. Just as a reminder, the fees haven't been updated. The fees were updated last year. They were subject to a 3.5% increase, but prior to that, they weren't adjusted since 2019. So we looked at the fees. Some of the fees didn't obviously didn't have a lot of rhyme or reason to them. So we've kind of sought to use our data to kind of back that up. So KT, if you can go up just up a paragraph. So on Appendix A that's in your packet, I put together kind of how much our estimated cost based off our staff and equipment to run their program. But just in so that's salaries and fringe benefits. So there's obviously other audited indirect costs, so like lights, electricity, those sort of things that we don't include in that. So KT, if you could scroll down to Appendix A, and then I can kind of talk through, and you can visualize it a little better than the words. So on this table here, and if you have any questions, feel free to stop me and ask away. But here on the left, we have the type of the facility that we do the licensure for. And then we have the total estimated direct costs. So that's including me, Amy, and Abby. So what we did is we took our time tracking data, how much time we spent in the program, how much we cost. So that's how we came up with that total direct cost for 2024. Total estimated revenue obviously is an estimated guess because we don't know what businesses might go out of business, what businesses might come into Dunn County. And we do have to reimburse the state 10% of what we take in to run the program. So, and And then on the far right is the percent of direct costs that are covered by the fees. So you'll see there for body art, 50% of our fees cover the time that we spend in that program. A couple things we can highlight too that's in your packet as well. The first one is on the food that we cover about 87% of direct costs covered by fees. You may remember that we took on a grant to try to meet FDA standards for our food program, retail food inspections. One of the standards is to do risk-based inspections so when we have a restaurant that's in the complex category, they have a lot of processes that they're doing. The standard is to do 2 inspections per year. Whereas right now our MOU with the state is that we just do 1 inspection per year. So we're moving forward with trying to meet that standard and to do 2 inspections for those more complex facilities. So that will increase our time spent in that program, so that next year that one may fluctuate a little bit, and that's kind of why we tried to adjust those fees in those categories.
Jeff, if I may,
Yep.
I understand the complex operation. What constitutes a risk-based assessment?
A risk-based inspection. So
Action
So the FDA wants us to do more of a risk base. So we're looking at if they have any special processes that they do. When we put them in these categories, it's based off the simple, moderate, complex is questions of do you cool your food? Do you hot hold your food? Are you acidifying any rice? Are you vacuum packaging meats? So the more processes and more things that they do creates more risk, obviously. So the risk-based inspection, when we're at a complex, just going 1 time a year, it's hard to capture everything in that slice of time. And so the risk-based inspection, going to 2 inspections for those, helps us to let's focus on some of these higher risk activities during a second inspection that in a single inspection, when we're already there for up to 3 hours, is hard to dig deep into some of those more high risk activities. Does that help answer?
Yeah, yes, it does. Thank you.
Yep. So you'll see that reflected. I think I explained that more in this memo above, but and then our lodging, another thing, it says we cover 101% there. So this summer we had intern that did a great job of trying to find tourist rooming houses, which are your Airbnb, VRBO type of rental, short-term rental units. He did a great job of finding many places in Dunn County that didn't have a license, so we sent out I think it was up to 27 letters, and so we ended up licensing 20 new tourist rooming houses. So with that comes a pre-inspection fee, a license fee to get them up and running. So that for this year may be a little high. I anticipate next year that it'll be probably closer to that 80 or 90% in the next licensing year. And then the third thing I'd like to note here is the pools that we're covering 98%. A new pool code went into effect as of September 2023. So we're going to spend a lot more time this year after July 1st doing education and helping those pools get caught up with the new pool code. So I'm anticipating that 98% is going to be a lower percentage come next year as well. And we'll talk more about the pool fees here in a bit. Any questions on this appendix or questions or comments?
Any questions for Jeff on Appendix A?
Perfect. Katie, if you want to go back up, we can talk through and then go to Appendix B and C. So KT did under fee changes and updates. She gave us that we received feedback about our transient, which is our temporary events, and our not serving retail food not serving meals complex fees. So the retail food not serving meals complex is kind of the wording they use that makes it complex, but this, think of like a grocery store or a meat shop, so not your traditional restaurant. So that's kind of what the retail food not serving meals categories fall into. So we got some feedback from some more smaller businesses, that grocery stores and whatnot, that felt like our fees were a little high. So we took it to the table, looked at neighboring counties, what they're charging, and we decided to for the transient temporary events to break it down into 3 categories, which we'll talk about here in a minute, and then to break the retail food not serving meals complex into 2 different categories based off their square footage. So KT, if you want to go down to Appendix B and C, it'll make a little more sense. So we'll start with the transient fees, or those temporary events. If you remember, our current transient fees are at 197, so it's just no matter what they're doing, we just had the one fee. What some of our neighboring counties and the state moved to is to more of a tiered approach to these. So a transient prepackaged, you can think of like if they're serving frozen meat and eggs from their farm at a farmer's market. Transient non-TCS, you can think about like if you go to the fair and you see them popping popcorn to sell popcorn, that could be more of that style of operation. And then our transient TCS stands for time and temperature control of safety for food. So transient TCS, they could be cooking, doing all sorts of different foods and whatnot. So we decided to take more of a tiered approach because it didn't make sense for somebody just selling frozen meat and eggs from their farm at the farmer's market to charge them $197 for their annual fee. So we broke it down to 70, 120, and 190 respectively for those temporary events. Any questions on that Appendix B?
Questions for Jeff? Go ahead, please.
Okay, perfect. And then what I mentioned before, the retail food not serving meals complex category, our fee for that was $1,075. That's our current fee. But there's obviously a large grocery store versus a smaller grocery store. The inspection is going to take less time. They may be doing less risk based foods. So what we decided to do is break it into square footage. So if they're less than 10,000 square feet, the annual fee would be $800 or a reduced fee. If they're complex, greater than 10,000 square feet, we bumped their annual fee up slightly for that. Any questions on that?
Hearing none. Polly, do you have a question? Yeah, go ahead, please, Jeff.
Okay, perfect. Katie, I think you can go up and we can talk through the next sections. So in the packet, it talks about that comprehensive strategic improvement plan, which is the reason why we're moving to 2 inspections instead of 1 for those complex facilities. Another thing that we updated, our pre-inspection fees have been aligned with time tracking data. So we set that at half of their annual license fee. So it's kind of the same approach we took to the plan review fee that we added last year. Also, a modest increase has been applied to our moderate category, just because the majority of our food licenses are in this category, and that's where we spend a majority of our time in those categories. The other thing before we move to Appendix D is I mentioned that we have a new pool code. And the state has changed how we license the pools. Before it was just based off based off the basin. If they had a basin for the pool, basin for the whirlpool. Now they're moving to more of a risk-based, kind of like with our retail food, where they have a simple, moderate, and complex, and then an additional fee if they have features like slides, and different things like that. So we kind of had to base our fees off what the state was charging, what others were charging, and try to make it so that they weren't a big increase to what they had previously. So KT, you can go down to Appendix D, and we can kind of see the big picture of all of our fees. So on the left, you'll see what our current fees are. And then on the right is our proposed fees. So the changes are in red. So obviously our pre-inspection fees have changed. There wasn't really a rhyme or reason to some of our pre-inspection fees. And based off our time tracking data, we wanted to make it more equitable for the time that we spent there. You'll notice that our campgrounds, special event campgrounds, we didn't increase those fees, or our body art. We kept those because we felt that those were based off our time tracking, didn't need additional changes. So in the one on the right, you'll notice, KT, if you scroll up just a hair, you'll see that we have the 3 categories for the transients there compared to just the one previously. And then down at the pools, you'll see public pools. Before it was, if it was a pool or whirlpool, if there's a water attraction, and then water attraction with 2 slides. Now we have simple, moderate, complex, with features. With the pools, their fee before was $347. So if they have, what we figured, if they had 2 pools before, or if they had a pool and whirlpool in this same setup, they'd be with simple with features, they would end up paying about the same amount. If one was simple and one was moderate, if that makes sense. About $700 before, $700 after, based off those fees. There's a lot of information here. KT, did I miss anything off this section that you wanted to add, or any questions?
No, not at all.
Okay.
Are there
Any questions?
Any questions for Jeff on this? This is a lot of work that you put into this, a lot. Yes, Supervisor Steen.
Yeah, Jeff, when this is brought forward to us after the first of the year, are you gonna have comparison, county to county on?
We already did that.
Okay.
So I
Stand corrected. I don't have it in front of me, so there.
It's great.
Thank you.
Right here. Thank
Yep. So I must
Anticipating
admit
all our
that
questions.
it's all right.
I
So,
apologize for my oversight.
No, you're good. Thanks for the question. Makes me look, makes us look good, like you're just leading us on. So I would want to share that all this work that went into this, Amy and Abby, KT, and Tiffany in our finance that helped put it all together. So it definitely wasn't all me, but there's definitely a help from everybody. So the Appendix E has the comparison of the fees from other counties and from the state, so you can kind of compare. Obviously, each of those counties are going to be in the same boat as we are, trying to change their fees with their boards coming up soon. So that's where we're at. So this obviously is just a discussion for today. We'll bring back a resolution and recommendations next month.
At this point, I'd really like to hear if you guys have any feedback, if this resonates with the conversations that we've had before, if there's anything else you guys would like us to compile so that you guys could consider it in January, or if you feel comfortable moving forward with something that looks a lot like this.
Comments from the board? I'm comfortable with the breadth of information that's here, but I don't speak for everyone. Supervisor Steen.
Yes, as we, move forward with this, one guiding principle is that I would like for the county, our county, to be user-friendly as opposed to the charges that they charge for various things, if that makes sense.
Yeah, thanks for that.
In other
feedback.
words, it should be easy to do business there. As easy as we can make it to beat the other guy. Thank you.
And I do think that when we had a couple of complaints last summer from the farmer's market, that the staff was very responsive. A number of us were also included in those comments in the resolution. So anything else for KT and Jeff before we act on this in January?
I guess one last thing I'd mention is our goal is to get 3 years worth of data. So this is kind of our second year of collecting all the data. So after we have 3 years of data, we'll take an average of all that. And then moving forward, we just kind of do a 3-year average. So it's not just every year. So that way it's a little more, it helps it not to change so drastically every year. So that way we can kind of get in a good rhythm with our fee setting
Yeah,
policy.
give us more valid data. So yeah, that's good. Anything else? If not, we're sorry that you're not here for birthday cake,
That's right.
but thank you. Thank you very
Yep,
much.
appreciate it. Yep, thanks.
Okay. Moving on, we will come back to our agenda. With Veteran Services. Greg, are you? Thank you.
All right, good evening, everyone. I'll start the report off with the overview for the local, state, federal benefits. So the local report of veterans or veterans office activity. A little bit going on with some veteran outreach as we had our program assistant attended an event at University of Wisconsin Stout, and the main goal for that, and working with the Minnesota Veterans Health, the VA Health Administration, Veterans Health Administration, as well as the Benefits Administration for the VA, is to get an opportunity to talk to the veterans that are utilizing UW Stout to get them enrolled in the VA for healthcare early, because a lot of times we overlook our health while we're young and in college, and then when we do then when we need it, it takes a little bit of time to get enrolled, and so it's typically a good outreach event. Also have representation from the La Crosse Veterans Center that provides mental health services for combat veterans, and so they give some free food and some coffee, and they get quite a few people will come and inquire. But I guess my overall assessment of it from the many years that we've been part of it is we've already touched most of those individuals, which is a good thing. So it's more some update discussions and trying to encourage a lot of those students to come back in to review benefits or just to get some updates on the changes that exist. We also have been in the planning phases for an outreach event this spring. We've already signed a contract with the Alliance Church. They for what our outreach event is, and really for the anticipated number of individuals that will attend, that they offer a great venue because typically what our structure has been, and we have a group of volunteers that are helping in the planning. But how we typically structure the event is about a 4-hour event to invite individuals in. Main topic that will be explored initially with individuals arriving in their larger gymnasium but when you invite vendors, they want contact with individuals, and people oftentimes are shy unless there's some candy or good freebies there. But it works well with the number of vendors that we typically will have there to really line the gym on the exterior so that they also can participate in like the main speaker and the overview of the event. So and then we're going to do some individual breakout topics, and we're still refining some of that, but with of course one of them is going to be surrounding the new toxic exposure to be able to educate folks, and then we're also more than likely going to have a mental health discussion and topic, and then possible some other options. But they have classrooms there, so it's good to have the breakouts, and then we just replicate that after a break, and so that individuals can hit a number of things. That has worked well for us in the past, and so we're gonna continue with that. Outreach events are always time consuming, and a lot of effort goes into it. So we're trying to utilize volunteers to help with that, but it's the right thing. And I know I've got some partners sitting across from me that some of their staff will be there. They usually are with the ADRC, and I think we've even had, I think Dunn County Transit even hired a couple people when they were there the last time we did it. On the state benefits side of things, was contacted as part of the leadership with the Service Officer Association for the state to pull in a team to do really a pilot test on their veterans management system that as service officers we have access to, and it's really their proprietary state system and how they manage veterans, but they need a whole overhaul. And so they wanted to include service officers as well as the tribal veteran service officers to get input and feedback, because we're their partner users in that. And I thought that was a good gesture. So we got a team put together of people that have some years of experience with that. So that had a first meeting a couple of weeks ago. It's all done virtually, and we'll kind of see where that goes. Because sometimes you get invited into things, but they just want to check a box. You know, nobody's really interested in your input. So we'll see how it goes, because there are some things that as an association we very much want improve. Reporting is one of them, to be able to easily do reporting. So I'll give some more updates on how that is, but that's a good partnership, and it really marries up well with what the secretary of the state Veterans Affairs Office, what is part as far as continuing to grow the partnerships and stuff. And so I think this really is a good gesture with that. On the federal benefits side, initial claims that we submit, I believe are really no impact on the initial claims with the new toxic exposure claims. I've been pleased with seeing how fast that those have been completed, and that helps reduce some of the anxiousness of individuals even pursuing them, because we can get results on we can give them an estimate in the process that they at least know, and so they don't let their anxiousness kind of get out of hand with continually calling for updates. The higher level review is one step in the appeal process. A notice of disagreements is an even more advanced level. Significant delays with those, and I think I've described at times just kind of how the business practice of just chasing the tail works within the VA, where you just move employees to try to address your current fire. And that's what's happening. And that's just the nature of the budget you have, the number of personnel you have, until you can match up and be at 100% strength. And they're under strength by reports with employees, and that's not, that's nobody's fault. I think every employer is trying to pull in good employees, but for them to be on track with those initial claims is a huge positive. And I think they'll be moving some of those folks to help address some of the backlog in the other areas. And that's just what I anticipate is going to happen. Probably the biggest area that I think needs to be addressed, and that as a association, even as our office needs to try to get some help and support from our congressional representatives on fixing the health insurance process for those individuals, the dependents of veterans that are 100% disabled or died from a service-related condition. The processing of those applications, just as an example, we have seen it take a year for them to process something that is already there that identifies the individual is 100% disabled, and things get hung up with, based on the reports, there's no consistency in the reports. And so what we now do, and I think I might have reported this last month or the month before, we're not waiting more than 30 days, just out of respect for the individuals we're serving. And that's what has been advised to us by our congressional representatives. Like, hey, if they don't have their health insurance cards within a month, let us know. We'll go ahead and follow up, because and you can't talk to a supervisor. There's no way to get that input. And so that's the only reason why we're using our lawmakers for support on that. But we've seen some huge distress for individuals, because, we all exactly what we all would do if somebody said, hey, don't worry about it. It will be taken care of, when you have a $50,000 bill that just came in the mail. You'd be a little panicked. I'd be panicked. It does get worked out. They do pay it, but it's something that could save a lot of time and headaches. So we're going to keep working on that however we can on our end, just alerting and notifying the representatives that there is a significant delay that is impacting our local veterans. I'll go through the financial report, and again, we still working with a couple volunteers in our office that are really helpful. And just an update on our medical equipment when it comes to, so our excess equipment, or even stuff that would have some flaws or need some repairs, we would still take it, because we had an avenue where we get volunteers to take the equipment to Global Health Ministries, which is in Minneapolis, because they had volunteers that could repair the stuff rather than just disposing of it. And they don't have that. That was reported back to us. So now we have to look to recycle, and we're trying to put the brakes on with some of the equipment that may be a wheel or something that our volunteer can't fix, or we can't rob off of another thing. So and I've already worked with Scott in facilities, so we do have a few things that we're not going to be able to take there. So we'll get that, but that doesn't impact what we do and the equipment that we have that goes out. It was just, what it impacts is there's gonna be stuff thrown away if we somehow get it donated. Sometimes it's hard to say no to somebody when they're trying to give you something. even though it might be 100 years old. Any questions about that part of my report? And I'll go right into the our client served, veteran served report. So no questions. I'll move into the impact statement for veteran served report. And I believe it's either I'm having deja vu or I must have mentioned this last month, but it's I look at it as a significant impact for the family, but it didn't bring in any money to the county, but it saved money for the family with getting a debt waiver approved. So at times, veterans can receive a debt waiver. Ways that happens is if an individual has a change in their household and they have a removal of a spouse or dependent, and it may not be reported in timely fashion, or it may not be processed in a timely fashion by the VA. That creates a debt because they overpaid. They want those funds back. They have ways to do that, typically by reducing any other benefits that you have. However, in some instances, things just get missed. In this situation, the veteran's 100% disabled, but not from the military, was receiving a wartime pension, income based, because it can't work, and that was higher than SSI. And so he's receiving that, but then, and the wife was caring for him, which there was no issues because there was no other money. However, when the spouse then became disabled, they started receiving their own benefit. When there is income tests to these programs, that put them over the VA's threshold for the wartime pension. And so, but that wasn't caught by the VA for like 20 years. But it isn't the VA's response. There's fine print that says you have to report any changes in your income. But the reason that this one was very reasonably not caught by anybody is because the spouse never anticipated becoming disabled. And that was like 5 years after they'd been receiving his other benefit, and it just happened, an accident. And so then started receiving that benefit earlier than it would have anticipated in life. And so anyway, the VA, I caught it and said, hey, we have to report this, and this is what's going to happen. And it resulted in $101,000 debt, because we can't overlook the obvious. That isn't what our job is. We have to advise and assist, and we help them through this. And that's why we put together also a debt waiver once it came. And in the end, they just do an income expense analysis. And this isn't the highest debt waiver that I've been able to get approved. The highest about 120 some thousand. And that was, again, a reasonable one that you could have, sometimes they're just not easy unless you're monitoring things closely. So I think that in my work, that was a great outcome, because they weren't going to get anything at all other than maybe $20 taking it from their benefit for the rest of their life. So that was a good thing for this family, and it really reduced a lot of stress for them. The other impact statement was we were able to coordinate, or Jessica, our veteran specialist, able to coordinate to bring Esprit. Is it Esprit? Yeah, to be able to bring Esprit into military sexual trauma group. And we've been trying to make this happen for a while, but Esprit doesn't work every day. I don't know how that works.
Great.
So Esprit is a we call it working
The therapy dog.
Therapy dog. Yeah, good animal. And so we're going to try to coordinate that more often with that group. Really was a huge hit. And we'll try to increase the hours. Maybe the budget can get approved and increase the hours for Esprit. But it just, again, it kind of shows the partnership. And again, when you're walking around the halls and you see something that you don't always see, and you start talking to the person, you realize like, oh, hey, this is cool. We've got to make something happen with this. And so, I thought that was a great thing to happen. Huge win for that particular group who definitely needs just unconditional love and support and have that nurturing that Esprit offers. So we're gonna try to make that happen again. And to point out as well, to try to get ahead of a question from Gary, our total pending claims, if you do a comparison, we're showing right now at this stage here in November of 307 pending claims, and we look back at last year on this time, 235, 232. I would believe that is a result of the toxic exposure and those additional claims. And I think that as we continue to look at trends, there's going to be really a new baseline after this goes for a while with the volume of claims. And again, looking at the real money that comes in, we're sitting at about 850,000, and that is money that is verified, deposited real time in individuals in our counties bank accounts for retroactive payments. Because again, there's downside and delays on claims, means that people suffer in the near term. But the upside is it makes our retroactive money look good, because then when they get paid, it's large amounts. And so, that I think hopefully that will get less as time goes on with how fast the VA begins processing, because they're using new technology to help with that. And I anticipate a lot of that will get taken care of as time goes on. Any questions regarding the Veteran CERB report? So I'll go into the financial report for the Veterans Office. So I'll hit the highlights. The main highlight is as we sit here today, anticipate no issues with the budget at the end of the year with what we had estimated for our budget, and that was approved, and what our actuals are going to fall in at. But a couple other areas, and if you can look at the 2023 actual column, we have we've received a large amount for our department, large amount for donations, 8,394. We had a few larger generous donations that have come in. So what that's going to result in is we'll have carry forward because of what those donations are intended for. I think that's positive. I think that's a reflection of people in our community that want to do good, want to find causes to be able to give money to. And anytime anybody asks, I mean, I don't beg for any donations. I actually try to turn them away because I want people to keep their own money, but I'll take it if they're like, nope, we want to do this. Absolutely, we'll take it and put it to good use. The other highlight under the program revenue, again, low dollars in the big scheme of the county, but big when it comes for us. If we look at what we budgeted for revenue is our flag sales. We're sitting there right around $1,165 coming in. I think we'll hit that. We have to hit, I think, roughly around $1,400 is what we have to hit. So I think it's just a matter of us making some deposits, to be honest with you. So I think we'll be good there. An area for me to answer to is we didn't have overtime budgeted. We've got a couple $100 actually charged to overtime. Don't anticipate any additional overtime, but we have a grant to cover that. So if that becomes an issue on that can't be covered in operations, which it will under this salary fridge, it will be able to be covered under there. But if it needs to be moved, we have money that'll be carried forward on our grant that we had received. And then under our relief cost center, it shows that there's about 6,600, little bit more left in there. That'll be gobbled up. We'd purchased flags that ordered and received so that they need to make sure that they're here by the end of this year. And that's just to get ahead in preparation for Memorial Day. So we have enough on hand. And our grant cost center, just as a reminder, we typically receive $11,000 in grant each year, but there was some leftover ARPA money that the governor had provided some additional money, over 15,000 as a supplemental grant for the service offices throughout the state. And that goes through the end of 2024. So that's why if there is anything that we need to cover that's allowable, like salary and fringe, we will definitely cover that. And I'll be carrying forward a decent amount of that because we intended on using spilling some of the work hours forward with a part-time employee into next year. So overall, budget's healthy, but those are a few of those areas. If you're looking at the budget, wondering like, why is this negative? You don't have overtime. This kind of explains those areas. Any questions regarding financial report?
Any questions at all? Greg? Go ahead, Supervisor Steen.
Yeah, Greg, the majority of what you talked about tonight kind of is summed up in the middle word of your job, veteran service officer. I was struck by the fact that you were able to help that family out, nothing for the county, but for them, a big deal. And I think that's part of what we offer in all our departments in the county is service. And I appreciate that. Thank you.
Yeah, thank you, Supervisor Steen. We all agree, I'm sure. Anything else for Greg? All right, thank you
All right,
very
thanks.
much. Excellent report as usual. Moving, excuse me, on to the health department.
Yeah, so in your packet, you guys have an update from the health department. Since it had been a minute since our last update, you did get 3 pages from us, but full of pictures. So I hope it balances out on total. So a couple things that I wanted to lift up. I did want to share that as part of the applesauce recall, we have worked with our local Dollar Tree. They were doing a great job. Everything was pulled. And so you have a picture of what we saw in the store there. But I want to share that as a result of what they're investigating as a potential intentional tampering of the cinnamon in the applesauce product and all of the media coverage of it, we are getting folks testing their children for elevated blood lead that wouldn't necessarily hit one of our metrics for testing. And we are finding in Dunn County, we've had one child that had an EBL of 10 micrograms per deciliter. Anything over 3.5 is over the CDC's limit. And so that parent decided to have their child tested because of the media coverage. And so I think it's a dual-edged sword, but hopefully they'll get to the bottom of it and we'll do what we can here locally. So I wanted to lift that up. Also wanted to share a little bit about all of the amazing work that our dietetic interns are doing. So we have had master's prepared dietitians come back and it's not a donation of their time. They don't get paid, but they have a very significant internship that they have to complete. And we were lucky enough to have that. And you saw a couple different projects that Grace was able to share with you guys on that. Also wanted to talk a little bit about environmental health. So you did see a very comprehensive, numbers are hard. You guys are troopers. I really appreciate that there were no snores during our conversation of fees. But I did want to share about pools. So that is a state rewrite on the reg. So one of the things that we're doing is we put binders together for all of our operators so that our next inspection is really more educational and we leave them with the resources they need to be in compliance. So I really appreciate the team for doing the work around that. And then I hope you guys enjoyed the dad joke that was in the update as much as I did. So Jeff found himself at the corner of County Road E and the County Road H, and he thought it was funny enough to take a picture. I love that. We got a fantastic amount of local media coverage for the community health needs assessment. And hopefully one of the things that you guys took away is that one, Caitlin Engel, our public health educator, did 3 live segments starting at 5:30 in the morning.
It was pretty.
Pretty dark, but she did a fantastic job, and it did help kind of elevate our partnership with Menominey's tourism and winter fun in Dunn. So hopefully you guys all saw that. And then we did some community health assessment outreach as well. So you saw the news segment that I did, as well as hopefully you saw our poster on how you can participate in that grounding exercise. So it's a virtual scan the QR code in the packet, and then you can join us on the January 10th or January 17th and give your feedback on whether or not those 5 top priorities that were lifted up from the 626 folks that took our survey really resonate with you. We're finishing up our last grounding exercise at the Karen House tomorrow. And we'll again see different folks see different things as needs within our community. And so if you've got somebody that is highly educated, highly resourced, they're going to see something different than maybe our Head Start and Birth to 3 play group, something different than the Karen House. And so we're really trying to find a variety of folks within the community to say, does this ring true for you? So please mark your calendar for the 10th or the 17th and join us virtually. And then lastly, I wanted to lift up, you saw some art in the update. That was some art supplies purchased with the donation in memory of Wendy McDougall, my predecessor. And what our nurse family partnership nurse was doing with that family was creating a memento in a mess-free environment. I think parents all can, they just shake their head at tempura paint, but when you can put it inside a baggie and make it mess-free, it makes things so much better. And so that parent worked with Sarah to create something special and also connect that back to a time in their life where they have a significant amount of support with our nurse family partnership program. So those are my updates. Any questions on the updates itself?
Informative written update. Any additional questions for KT? All right,
Okay.
moving on.
So the CSIP, you guys saw that in there. So this is the assessment that the team did of their programs. Nothing is marked as in compliance, completed or in progress. That's the next step. You did hear some of those large things being lifted up about risk-based assessments. One of the benefits to seeing our complex restaurants more than once a year is that we can help install a culture of food safety. But the other benefit is that the things that aren't as risky, like tourist rooming houses, we can see them once every 2 years. So that would be a good trade-off for us if we move forward with that. Also in your packet, you saw the year end for the Epi Express. So the Bureau of Communicable Diseases gave some updates, as well as year end communicable diseases. That is for the state. That is not for Dunn County. You'll see our annual report in April, and that'll have our local data. Respiratory viruses, if you have not noticed, we are seeing a significant increase in respiratory viruses. We have had our first pneumonia-associated death of a child in Wisconsin that was due to RSV. And so we are still trying to get folks, if they haven't gotten their flu shot, if they haven't gotten their COVID booster, if they haven't gotten an RSV shot and they're eligible to do that, because we are absolutely seeing all 3 of those things on the rise and here locally. And so that data for the state is fairly consistent with the data that we're seeing locally. And then you did get an antibiotic prescribing report from the state. I think that is important for you guys to have some awareness around, just as we look at antibiotic resistance and where we have overprescription in different segments. And so they're looking at that carefully, looking at it from a public health lens to make some changes. And then lastly, we have had a couple conversations about PFAS. And so you have the Green Fire Institute's kind of overview support, gives a lot of information around PFAS. and hopefully could answer some of those deep dive questions that I'm not able to answer. That's what I have in your packet. Any questions before I jump to financials?
Any questions for KT on her informative reports? No? Okay.
Awesome. So looking at where we are through November, you will see that we have done some really tightening of our spending. You will also see that some of those budget adjustments have hit SAP in a way that we're showing more grant funding. So part of that is that we had quite a few, if you guys will remember, things that we're posting in our admin cost center. We have finally got them into the grant cost centers where there are funding for that. And then we had just been really mindful about not spending on different supplies that we don't need. Obviously, if we need the supply to see somebody in our reproductive health clinic or for immunization, we will do that. But all other things have really been battened down. So I'm happy to see that there is a pretty significant swing to the good. And we will see what our last month brings, but it'll probably be someplace in between, quite frankly.
Okay. Any questions on the financial report? Oh, okay. Well done. Good management. Human Services, it is your turn.
Thank you. I will just add on top of Lori's report tonight that regarding the Family and Treatment Court, I did want to comment with that as we know, anytime that you're able to prevent determination of parental rights, we are looking at preventing significant trauma in a child's life. And that trauma, when you put it in dollars and cents, is huge. Many times we see children that have their go through a termination of parental rights. In the end, as they grow up and into adults, many times return back into families. We have failed adoptions with that. There are some successes and stories, but there was a lot of trauma and impact on families. And so I just wanted to add that in onto Lori's report because I think we don't talk about that enough.
Yeah.
And to know that impact. Also, you received my report this evening in front of you, and I wanted to mention that public health is not the only one having fun with some art. And our dementia care specialist, Carla, she was spotlighted on WEAU, and it was in the report of what they're doing with the money that they receive from the Mayo grant and working with individuals with dementia. Some cool stuff going on there with that. And also I put in the report that underneath the financial that we have received additional money from 2024 through 2026 for the EDRC, or Aging and Disability Resource Center, by $76,794. And we were not sure at the time that I wrote this that all of the current grants that are included, because we have a lot of small grants in that, if they would all be part of that or not. And we found out after I wrote this report that they are in the regular contract. So this is all new money for us, which is really exciting. And Tracy has a lot of great ideas that she's already working on. And I said, let's wait till we get the contract first. Well, the contract got here this week. Chris signed it. So I think we're meeting next week. She's got it all lined out. So she's pretty excited about how we can increase services to our ADRC folks in our community. So that was great news there. And then also just a spotlight. We just have a lot of staff that have been here for a long time, and that was kind of fun as I was putting those numbers together. 29 years, 28 years, 24, 21. And that just is not typical to have that number of years. And so celebrating that, just want to call that out as well. So I don't know if you have any questions for me on my report.
And Sarah Stabenow is leaving us.
And Sarah Stabenow is leaving us. Yes, so that will be a change. We're
That will
trying
be a
to,
fairly significant
Yeah,
change, I
well-
should think.
we're trying to capture everything in our brain that we can.
Yeah, right. Just lock her up for a few days.
Yeah.
Okay.
So Beata's, working on a plan and all of that kind of stuff. I'm sure that
Maybe you were too mean to her.
Um,
And from your report, my congratulations to Becky and the Family and Children's Unit for the changes that you're making and
mm,
seemingly doing it very well. So thank you for sharing that with us and thank you for
Mhm.
doing it.
mhm.
Are you through?
I am. Mhm.
Any questions, comments, anything for Paula? Okay, money.
Money, money, money. So when we met in November, we did not have the financial reports yet because it was November 9th. And so Jerry did put in the packet the October and November report. So if you look on the documents on the running bottom of it, the one that I'll talk
Right.
about today is the one that includes November. So that, you know, you have them, but it makes no sense to go back to October unless you have questions. So currently in November, we are projecting here that we will be to the good of $929,705. The exciting news is that Chris and Jane Hansen worked on the WIMCR as well, and we just received that check this week, or checks, I should say, for to the tune of about 450,000 that will be credited to 2023 as well. So you'll see that in addition to the potential $900,000. So that will be a nice ending year result somewhere in there.
Yes.
Find it to 1.3 then, probably.
Mhm.
Yeah,
It-
that's right.
It won't.
It
The number
won't.
was already calculated in the projection.
Oh, it was calculated in the projections? Oh,
If it's at 900, that's what it's going to.
gotcha.
Thank you.
Thanks, Chris,
Okay.
for that clarification. I
Okay.
thought it was added to it.
Okay.
Oh, I was so excited
Well, it
when
was
I
so
was
nice
thinking
to
that. Yeah.
contemplate the
yeah.
addition.
Well,
Well,
still like
900 is.
900 is nothing to sneeze at.
Right?
Yeah.
Exactly.
All right.
All right.
Any questions on the financials?
Any questions on the financials or anything else? All right. We have review of the November, yes. DHS vouchers paid. The amount this month is $670,000, 698.41. Any questions when you review these? Comments? All right. I need a motion to note review of the November vouchers.
I would make a motion that we reviewed them. And is there any additional explanation that you'd like to make or need to make? All right, thank you.
This is our checkbook. Is there a second? Mr. Lamb seconds. All in favor?
Aye.
Aye. Any opposed? Vouchers are noted. And unless anybody has announcements. Meeting date, yes, correct. Meeting date, regular meeting date. Thank you, Gary. Where do I have it? It's the 25th of January, 1/25/24. Shall we see you all there? All right. And without objection, we are adjourned.
Happy New Year.